audio input has to be kept off throughout the quiz. Okay. So with this, now it's time for us to begin the second episode. Let me share my screen. So friends, good evening and welcome. And my special pranam to all the mentors who have logged in today. We see about 20 odd mentors who are representing their own teams to boost not only their energy, their efforts, but also as a brain teaser, as well as a big Q gang. We are in fact privileged to have you, and we feel a pat that you have joined us. So Brain Teaser today, in association with Ophthalmological Society of Nagpur, is presenting a pan-India quiz that is Big Q. So this is the signature tune of our Brain Teaser. This is an online quiz which has been conducted for last 4 years. It's not only an education, but it is also an entertainment for each one of them. So this is the 4th season of our Brain Teaser episode. And this is for Big Q. So remember this, students, look at this, students. One of you or one of the team is going to be the top. There are big prizes for top 10 performances. So good evening and welcome once more to all the participants, and my pranam to all the gurus, that is mentors, who have logged in for today's episode. Friends who are new to our platform, Brain Teaser is an online quizzing platform which was introduced about 4 years back by Team Sarakshi Netralaya with an aim to have an edutainment program for ophthalmologists across the country. Since then, it has been associated with various state, national and international societies for conducting their quizzes, to name a few: Delhi Ophthalmological Society, Bombay Ophthalmological Association, All India Ophthalmological Societies, and almost all state societies. Last year, we had the privilege to host for the first time in our country an All India Postgraduate Quiz in association with Bombay Ophthalmic Association. Buoyed by the success of Big Q, this year, the Brain Teaser, in association with Ophthalmological Society of Nagpur, that is OSN, has decided to host once more an All India Postgraduate Quiz. We are extremely excited by the response we got with having 573 teams participating in our first episode. And besides that, almost another 300 plus ophthalmologists playing the quiz on various platforms. We are extremely humbled, thankful, and by your overwhelming response. But yes, overwhelming participation naturally meant some hiccups during our first episode. To rectify that, we are upgrading our own Zoom platform so that every one of you can log in to the Zoom platform from the next episode. As an interim measure, this time we will have first 500 teams on Zoom, and the rest will log through YouTube and can play and score and be in the contention. Dear friends, today we have two special guests to grace today's episode and bless us all. Dr. Lalit Verma, President of All India Ophthalmological Society, which is the largest national society of ophthalmologists across the world, also an eminent vitreoretinal surgeon. We are extremely delighted and blessed to have you, sir. Students, remember, Dr. Lalit Verma as well as Dr. Namrata Sharma were in an AIOS meeting till now, but they agreed and they came, and they're still traveling from office back to their residences, but they have logged in, and that shows their commitment. And this is the commitment which you students also should have in future to excel like these people. Also, I welcome Superwoman in Indian Ophthalmology, Professor of Cornea Department at RP Center, Delhi. Of course, it's none other than Dr. Namrata Sharma. Secretary, All India Ophthalmological Society, and soon going to be Chair Scientific Committee of All India Ophthalmological Society. Welcome, ma'am. We also have as a special guest this time, our President of Maharashtra Ophthalmological Society, my dear friend, Dr. Santosh Bhide, who is agreed to be and consented to be part of our program. Of course, our own host president from Ophthalmological Society of India, Ophthalmological Society of Nagpur, Dr. Neha Deshpande, is also today with us on today's episode. Welcome, Dr. Neha. This year, we also have added new dimension to the Big Q by having quiz masters from across the country who themselves are ace quiz masters of their region. Today, we have the privilege of having 3 quiz masters. The first is Dr. Uma Kulkarni, professor at Yenopaya Medical College, Karnataka, an avid quiz master from Karnataka, and a very old associate of ours of brain teasers. Dr. Rohit Saxena, pediatric ophthalmologist and professor at RP Center, Delhi, and a dear friend of mine as a second quiz master. And Professor Dr. Vaishali Une, who is a professor at Medical College, Dhule, a multifaceted lady. So friends, remember today we have 3 professors who are going to quiz you. But I hope students, you don't panic. They are all very mild people and they love you all. So the questions are going to be as loving and as easy as you will see once they go through the quiz. Welcome all to the quiz masters. The brain teaser also had a big following of general ophthalmologists who wanted to rub their shoulders with these young postgraduates. So we also have separate category of prizes for comprehensive ophthalmologists in every episode, about which Dr. Shilpi, my colleague and co-host, will be telling you in details. Every registered postgraduate not only becomes eligible for participation certificate, which will definitely add weightage to their CV, but also he gets an opportunity to brush his knowledge and share the dais with the who's who in ophthalmology. For 6 winning teams, there are huge prizes, which Dr. Shilpi will be elaborating shortly. We welcome all the mentors who will be guiding force for every team. As a token of our appreciation for the efforts, every mentor gets a surprise gift from Big Team Q. And besides the cash prize of rupees 15,000 rupees for every mentor of 6 winning teams of the final. We are thankful to Mr. Sai Krishnan and his numeratic for giving us efficient back office for smooth conduct of this online quiz. Money makate mayor go. Nothing is possible without a financial aid from our trade partners. We are extremely thankful to Micro Labs for their generous support, and to mention few names, Mr. Ashok, Executive Vice President, and Mr. Navneet, who are really working hard to reach out to every student in every corner of our country. Here is a promo from Micro Labs. Just let me share the screen. Thank you, Micro Labs, for this such a strong support to us. Now it's my time to introduce to you Dr. Shilpi Narnavre, my VR colleague at Sarakshi Netralaya Nagpur, and also a co-host for today's function, rather every Big Q episode, to introduce you to the format of this quiz as well as the rules of the game. Over to you, Shilpi.
Thank you, sir. Good evening, everyone, and welcome to the second episode of Season 2 of Big Q. So let's look at the format of the Big Q. So this Season 2, it will be conducted every Wednesday at 8 p.m. The platform for answering is Kahoot. So total, there are 15 episodes. In that, there will be 8 preliminary rounds, 4 quarterfinals, 2 semifinals, and 1 final. So in that 8 preliminary rounds, total of the best 4 performances of the team will be calculated, and based upon that, they will qualify for the quarterfinals. So what happens if one misses the few preliminary rounds? So as I already told, minimum 4 need to be played to qualify for the quarterfinals. So in quarterfinals, there will be total 80 teams. So total of the 4 best performances will be calculated. In semi-finals, out of these 80, 20 will qualify. And out of these 20 teams, 10 teams will play the finals. So this is Kahoot platform from which you need to answer the questions. Every team needs to log in from 2 devices. The first screen is a live quizzing, which will happen on the Zoom platform. And all the teams should have their videos on, but their audio should be off. And for answering, Kahoot is to be used. So mentors to log in from a separate screen, and that too only on the Zoom platform. So the format is, in this quiz, there will be 9 rounds, 6 sets of MCQs containing 5 questions in each set, and the 3 sets of one-liners, which will be having the 5 questions in the each set. So the assessment will be done on the basis of fastest finger first and the correct answer, and there will be no negative marking. But remember, judges and host decision will be final. So now look at the prizes. The team at the 6th position in the final will carry away 5,000 rupees, and in the ascending order, it will be 10,000, 15,000, 20,000, 30,000, and 50,000. All the mentors will get the surprise welcome gift, and the mentors of the 6 winning teams will get 15,000 cash prize. And for our audience, those who are not PGs, the second runner-up will get rupees 2,000, the first runner-up rupees 3,000, and the winner will get rupees 5,000 per episode. So now I welcome the first quiz master for today's quiz, that is Dr. Uma Kulkarni ma'am, who is professor in ophthalmology in Yenepoa Medical College, Mangalore. Besides ophthalmology, she has interest in teaching, research ethics, bird photography, poetry, and quizzing. Over to you, ma'am.
Yeah. Thank you so much, Shilpi, and thank you so much, Dr. Prashant. And thank you all. Shall I share my screen?
Please, ma'am.
Yes. Yes. So
Yes,
here we go to the first part of the MCQs, that is question number 1.1. This is MCQ part 1, round 1. So let's begin with what is my favorite, and that is optics. So I'm sure many PGs find optics a little difficult, but let's start with a simple optics question. And the first question, that is 1.1 on optics, is look at this diagram and tell us, this diagram represents A, listings reduced eye, or is it B, Helmholtz schematic eye, or is it C, Gulstrand schematic eye, or is it D, modern schematic eye? Your time starts now. Time is up. I hope you all got it.
Madam, hold on. Don't announce the answers now.
Yes.
The time is not yet up.
Yes.
Yeah, madam, it will be some lag because of the Kahoot platform.
Sure.
How much time should we wait, Sai?
Yeah, it's time out now. You can go ahead.
Yeah, please.
Okay. So I'll go ahead with the answer, and I'm sure most of you all have got it. And the answer is listings reduced eye. So you can see very clearly there, there's a single nodal point and a single principal plane, and there's one F1 and F2 there. So that was listings reduced eye. And if you've got it right, you have paid all the tribute to all those people like listings and Helmholtz who have done a lot of work in this field. So going to 1.2, okay, and it's on thyroid. Let's see what the question is. And the question is, in thyroid eye disease, which system helps in grading both activity and severity, and at the same time helps in differentiating the management categories? Okay, three things. So option A is Werner's no specs classification. Is it B, clinical activity score? Or is it C, UGOGO classification? Or is it D, the visa classification? And your time starts now.
Time up, madam.
Yeah. So can we have the answer? We have the answer now. And the answer, as you all have known, is UGOGO classification, because visa and UGOGO both give both grading of activity and severity, but UGOGO has the advantage of differentiating the management categories also. So that's the answer for 1.2. Let's go to 1.3. Okay, something related to chemistry. Let's see what chemistry we'll have now. And the question is, what chemical process is responsible for the hardening of cyanoacrylate, as in the glue? Option A, is it oxidation? Option B, is it hydroxylation? Is it C, coagulation? Or is it D, polymerization? And your time starts now.
Time up.
Okay, so here we go, and the answer is polymerization, and that's the answer for the super glue, and that's the chemical process which is happening. And now we go to question number 1.4. Hope you all are ready. And the question is something on retina and optic nerve. Let's go for it. Name the most common macular complication seen in this condition. You'll have to see very carefully the photograph which is given there and name the complication. Is it A, cystoid macular edema? Is it B, serous macular detachment? Is it C, choroidal neovascularization? Or is it D, macular schisis? And your time starts now.
Time up.
Okay, so as you all know, this condition was optic pit. Okay, and the condition that is associated, complication that is associated is serous macular detachment. And there's a collection of intra and subretinal fluid, sometimes called a double detachment, which is seen in the macula. The origin of this fluid is still questionable. So we move ahead to 1.5, question number, once again from one of my favorite topics, and that is neuro-ophthalmology. So let's go for the question. The question is, which extraocular muscle supplied by the third cranial nerve is innervated by contralateral subnucleus, not ipsilateral, contralateral subnucleus? The options are A, superior rectus, B, inferior rectus, C, medial rectus, and D, inferior oblique. And your time starts now. And the time is up. Can we go for the answer side? Yes. And as you know, anything that has a term superior in it is not supplied by an ipsilateral subnucleus. So the superior rectus is supplied by contralateral subnucleus of the third nerve. Superior oblique, of course, is supplied by the contralateral fourth nerve, and levator palpebrae superioris is neither ipsilateral nor contra, but it is a bilateral representation. So with that, we come to the end of the part 1 of the MCQs, first 5 MCQs. And now I have the privilege of presenting before you Dr. Rohit Saxena. He's a professor at the RP Center for Ophthalmic Sciences at AIIMS, New Delhi. He's a pediatric ophthalmologist, a strabismologist, and also has a keen interest in neuro-ophthalmology. He did his MBBS from AIIMS, MD ophthalmology from AIIMS, PhD from AIIMS, and he has a FACO fellowship from AIOS. He has more than 250 index present publications, and he has been a guide for more than 42 postgraduate students. He's an editor of 3 books, including a video atlas. He's invited as faculty for more than 25 international conferences, regularly conducts instruction courses at AIOS. He's an invited speaker at various national conferences and CME meets. He has performed live squint surgeries in national and state level conferences. He has more than 33 international and national awards to his credit. Some of them include Excellence in Strabismology, AAO Best of the Show Video, AIIMS Excellence Award, Fan Favorite Video, Best Research Paper, and APAO Achievement Award, AAO Achievement Award, and many more. I think he has hidden a lot of information from us.
Thank you. Thank you. Thank you, Dr.
Thank you. Now I'm sharing my screen.
Yes.
Yeah.
I'll share my screen. Thank you, Dr. for the kind introduction, and welcome everybody. I'll go on to welcome you all to this quiz, this wonderful system that we have, the Pan-India International Inter-College PG quiz, and I'll quickly move on to the questions. I'll just do full screen. Yeah. So MCQ 1.6. So what changes to standard confrontation visual field testing? So we're talking about confrontation visual field testing would increase the ability to detect subtle visual field effects. So we're looking at subtle visual field effects. Would it help to perform confrontation at a closer distance, using red targets to check for color desaturation, performing visual field stimuli with a Finhoff illuminator, or performing visual field stimulus with movement of the fingers or hand? The time starts now. This is to improve or detect subtle visual field effects. So, Sai, do we move on to the answers?
Yes.
Okay, great. So hopefully you all know how to do confrontation visual fields, and we're talking about the modification. So using a red target to check for color desaturation, that will pick up very subtle visual field effects, because color desaturation is one of the early features of visual defect or visual functional defect. So you're going to test not only a field, but also color along with your confrontation test. So that was for the first question. Let's move on to the next question. In an eye with narrow angle, which of the following most strongly argues in favor of performing a laser peripheral iridotomy? Rather easy question. I'm just going to go for the choices. The first choice, amount of glaucomatous visual field loss. B, amount of glaucomatous optic nerve cupping. C, gonioscopic findings. And D, the intraocular pressure level. Now argues in favor of performing a laser peripheral iridotomy. So rather simple question, and Sai, we move on.
Yes.
Great. So I think that was quite a sitter, gonioscopic. That's how you're going to decide PI, because angle closure, PI, open angles, no PI. Rest are all on the severity of the glaucoma. So that anyway means that the patient requires some amount of glaucoma intervention or not. So let's move on to the next question. Incision and drainage of an infected dacrocele through the skin should be avoided because it can cause infection of the eye, can cause necrotizing fasciitis of the surrounding skin, difficulty in skin closure after the surgery, or the danger of creating a persisting fistulous tract. So now IND of an infected diaphragm. So again, I think a rather straightforward question. We move on to the answers. It's the danger of creating a persistent fistulous tract because the infection is going to open the wound from there and it's going to continue to be a fistulous tract, and all other things are not really that relevant. So that's the most important reason why you should avoid the skin when you're operating. So I hope that was a rather a practical question. We'll go on to the next question. 1.9. So keratoconus is typically associated with marfans. Keratoglobus, on the other hand, is associated with which of the following? So whether it's the Loeys-Dietz syndrome, the Ehlers-Danlos syndrome, epidermolysis bullosa, or osteogenesis imperfecta. Start your time. So association of keratoglobus in which syndrome? So we have been on the tough side, but the answer is the Ehlers-Danlos syndrome. Both the Loeys-Dietz syndrome and the Ehlers-Danlos syndrome are collagen diseases, and Ehlers-Danlos, the Loeys-Dietz has other things like telecanthus. We know that osteogenesis imperfecta, made popular by a lot of movies, is the brittle bones disease, and epidermolysis bullosa is a skin disorder where even mild bruising caused bullae to form. So this was about keratoglobus. And I think I move on to the last one, 1.10. What is the percentage of the following finding or disease or event occurring bilaterally? So you look at the fundus and tell me how frequently will it be bilateral? 10%, 5%, 15%, or 20%? So of course, you need to identify that. What this is, you can see that it's myelination of this that is happening. It's important to identify. Of course, per se, they don't cause anything. It can be seen bilaterally in 20%. Per se, this is not a problem. It's important to note it in a patient because in cases of demyelination, they may actually get lost and maybe a finding for demyelination. And other than that, if it's small or if it's extensive, it can cause significant field effects, or it can be very extensive and actually involve the macula also, where it can be actually. So that's what we can see. And that ends my part of it. And again, it's a pleasure to introduce my next quizmaster, Dr. Vaishali Une. She's a pediatric ophthalmologist and strabismologist, and currently the professor and head of SBH Government Medical College at Dhule. She's been the past president of the Aurangabad Ophthalmological Association. She's an ex-scientific committee member of the MOS. She's been the scientific committee member of Maharashtra State Chapter of the ISMS-ICS, ex-zonal member of MOS, editor Blink MOS newsletters, to a huge amount of contribution. She has teaching experience of 23 years. She's presented in a lot of international conferences, has numerous publications. Besides, of course, her profound capability in ophthalmology, she has a lot of abilities and very active culturally, and was the AIOS LDP member, a distinguished and an outstanding member of the LDP in 2019 and 20. So welcome, Dr. Vaishali. I'll stop my share.
Thank you so much, sir. Yes, thank you for your generosity. And it's a great pleasure being here along with you all. And just a moment, I'll just share again. Yes. So again, I welcome all dear students, and both Dr. Rohit and Dr. Uma Kulkarni ma'am's questions were very, very interesting, and I wish I was on the other part. So let's begin. A bull's eye maculopathy is caused by, isn't that simple one? To start off, A is quinine, or is it streptomycin? Is it chloroquine, or it is streptomycin, or time starts now. Done? Sai?
Yes, go ahead, madam.
So all must have got it correctly because it is quinine, and we get many of the questions, references from the medicine department for the fundus examination. So now coming to the second part, the triad of pituitary apoplexy does not include headache, blurring of vision, is it diplopia, or is it subarachnoid hemorrhage? And your time starts. Time's up. And the answer is yes. I'm sure you all must have got it right. Blurring of vision does not form the triad. It is only formed by the headache and diplopia and evidence of subarachnoid hemorrhage. Moving on to the next question. The madam had started with the thyroid eye disease. I continue with it. So the lower eyelid sign, mind well students, it is about the lower eyelid sign of thyroid eye disease is caused by Dillenick, or is it Gifford, or is it Griffith, or is it Groove? All G. Time starts now. Time's up, and all the G answers, 4 Gs. So the answer is Griffith. So thyroid eye disease is a very important topic, both from the practitioner's point of view and more from the student's point of view, because you need to know absolutely everything regarding thyroid eye disease. And moving on to the next question. So Dr. Rohit and me was very fond of this, and very simple also. Grades of binocular vision does not include A, simultaneous macular perception, SMP, B is fusion, C is fixation, and D is stereopsis. And your time starts now. Time's up, and I'm sure all the 500 odd participants have got this absolutely bang on correct, and it is fixation. So rest of the three are absolutely necessary for the different binocular single vision. Moving ahead, the angular artery and vein lies, this is related to our dacryocystitis. So during doing the cystorhinostomy operation, we have to pay attention to the angular artery. So it lies how many millimeters from the medial canthus? The options are 5 to 6, or is it 6 to 7? Is it 7 to 8, or is it 8 to 9? We have to be absolutely perfect in our anatomy while doing the dacryocystorhinostomy surgery. Your time starts now. Time's up. And again, I'm sure very simple. This you JR1 all must be well versed with this. And the answer is 7 to 8 millimeters. Moving ahead to the second questions. Now this is about our one-liners. So in this, I want to tell all the participants that if you have a numerical answer, you please write it, say the answer is 5. So you write FIVE. So don't put the number, otherwise it will be considered as wrong. So we are now moving on to the one-liners. So the number of long posterior ciliary artery is you get 30 seconds for it. Twenty more. Time's up.
Madam, do not reveal the answer. Just hold on for a minute.
Sure. We all love one-liners, don't we? And especially when it is associated with academics, more the fun. I'm sure all of you have got this answer perfect. Anatomy.
Ma'am, Vaishali ma'am, I
Yes.
think ma'am needs to share the first questions because
The Kahoot will not
will
accept.
not accept the answers.
And one-liners, we have to go back
Okay.
first, madam.
Okay. I'm sorry.
No issues.
Shall I stop my share?
Yes, ma'am.
You share, and first one-liners will be done by madam, and then it will come in the same sequence.
Okay. I've stopped sharing. I now request Uma ma'am to start with the one-liners.
Yes.
Thankfully, the answer was not out.
Okay. So we move on to the one-liners. And this is question number 1, 2.1.
Madam, they have already answered. Probably you can go to the answer now because Kahoot showed up this question.
Sorry?
What do you want? You want Vaishali to continue?
You just show the answer of this question and go to the second question.
Answer for 2.1, is it?
Yeah.
Yes.
Okay. Okay, got it. So I just hope we had some interaction. Otherwise, I would have discussed this. So I'm going on to the answer, and the answer is indentation gonioscopy. So we move ahead to 2.2, and the question number 2.2 is a bouncer, I'm sure, and let's give it a try. What is motion blindness called? Your time starts. Sai, reveal the answer.
Yeah, you can announce the answer.
Yeah. So the frames, the vision appears as if it's a frozen frame, vanishing objects are seen. It's a very rare condition, not affecting the striate cortex. And the answer is A, kinetopsia. At least one or two bouncers you should have, and that's why this question appeared here. Let's go to question number 3. That is 2.
Request once more. Sorry, Uma madam. Request all the participants. Remember, your questions, answers have to be spelling wise fully correct. Otherwise, you will not score the marks. So please do not. If there is some deviation, we will be giving you a negative answer. So please do type properly. Thank you. Sorry.
No, that's perfect. That's perfect. So we go to the next question. That is 2.3. And through 2.3 is this. What is the most common cause of pan-uveitis in India? Your time starts now.
Yes.
Okay. I think once you have a bouncer, you should also have very, very easy question. And you all must have answered this question correctly. It is tuberculosis. In India, most common cause for pan-uveitis. So shall we go to 2.4? Once again, another easy question. That is, in CRVO, markedly reduced amplitude of the B wave in ERG is suggestive of which type of CRVO? Your time starts. Well, it's a very easy one. Very easy question. You had the options on the screen. Shall I reveal the answer side?
Yes.
Yes. So the answer is ischemic type of CRVO. So we should know all the signs that are suggestive of ischemic, and one of them is the B wave in the ERG. Last question now, for now. What is the wavelength of frequency double Nd:YAG laser? You just have to write the numbers. Okay, nothing more than numbers. Your time starts now.
Yes. Yes.
Yes, you have to get this right. You can't get any other number for this, and that is 532. So with that, we come to the end of 2.5. I'll hand over to Dr. Rohit Saxena now. I'll just stop sharing and hand over to Dr. Rohit Saxena.
Thank you, Dr. Uma. I'll just share my screen. Sai, I'm not very sure I can see the timer in my presentation, so I don't know.
I'll guide, Doctor.
Okay, so we go on to the single word answers. Remember, they are only alphabets, no numeric. So let's go ahead. I start my full screen. So the first question is 2.6, which is the abnormal pupil? So it's the left one or the right. So you need to write, you can see the size of the pupil in room light, bright light, dark room. Your time starts. I don't think, Sai, there is a timer. That's why.
I'll let you know, Doctor, once time's out.
We'll
Sure. So these are the pupillary sizes in the various lighting. That's how you differentiate the abnormal pupil, the test to check for which eye is the abnormal pupil.
Time out, Doctor.
Okay, great. So I guess it should be easy. This is a standard thing. It's the left eye. So when we look at this, you can see that it's not dilating enough, whereas constriction, both are constricting adequately. So the dark room, the pupil is not dilating enough. It's the left eye. You go on to the next question. The most likely diagnosis of lesion in this MRI picture of the brain is, so you look at the lesion and what is the most likely cause, and we start your time. Of course, we are not asking you to interpret the site, but essentially, what is the likely diagnosis?
Time's up, Doctor.
So this was a post-contrast image, and the answer is tuberculoma or tuberculoma, we'll call this. It's a ring-enhancing lesion around a central cavity pre-lesion. So this, you can see, is a tuberculoma. We go on to the next question. What is the most common cause for the condition shown in the figure below? So the most common cause, your time starts now. You need to, of course, identify what is the problem and then tell the most common cause of this. So although it's a very busy images, you need to have a way to go through 9 gazes.
Time out.
To get answer to identify the actor.
First, of course, we need to identify what this is. If you see, if you come across any 9 gaze, you start from the central image because that's the primary gaze. You look at primary gaze, that doesn't appear to be anything significant. You look at dextroversion, you can see this eye is going up. You look at levoversion, this eye appears to subtly go up. Then you can see straight up and down. There is a little V pattern that you can see. The eye is a little inturned. The eye is, up and out a little. So there is a small V. And you look here in dextro elevation, this eye appears higher. In levo elevation, this eye is marginally higher. So here again, you can see this eye is higher than this eye. So essentially and then of course you do the head tilt test on both sides. You can see on left sided, the left eye goes up. On right side tilt, there is a subtle right side going up. So this is a bilateral superior oblique palsy. Whenever you are seeing a unilateral, you always check for the other eye, especially in cases where the answer is in this trauma. So a bilateral superior oblique palsy, most common cause trauma, back of the head, or even moderate minor traumas where the two nerves are they crossing over, you get a bilateral superior oblique palsy. So we now go on to the next question. 2.9, diagnose the condition or what is the syndrome of this 5-year-old child, and your time starts now. I talked about how to interpret a 9 gaze. So again, a 9 gaze and the head posture of the child. What will be your diagnosis be in this patient?
Time out.
Okay, great. So let's again interpret. You can see this is a face turn or head posture of this child. This is the prime gaze. Again, doesn't look too bad, but the moment the child looks on levo version, you can see this eye is dipping down, this eye is looking, and this eye is dipping down. This dip is increasing here, but when she's trying to look up and left, you can see this eye is not going up. So superior oblique is overacting here, but you look here, there is a V or a Y pattern. So this eye is drifting up and out, and nothing else really significant here. It's going up and out. So this is a right Brown syndrome. The eye is not going up and in, and that's what the answer is. So a Brown syndrome of the right eye. That's why the child has a head posture with a head posture, face turning to the left. The eyes in dextroversion, that's when the eyes are properly aligned. So we talked about how to go through a 9 gaze. And finally, 2.10 or 2.10, single most important clinical test to be done in this 55-year-old patient who presented with diplopia for 2 weeks, preceded with headache for 3 months. So he had 3 months headache, diplopia 2 weeks. This is his clinical presentation. What is the single most clinical test? And we start your time. Again, what is your diagnosis? And then we'll try and think about what is the single most important clinical test that we need to do. So it's a clinical test, not what you order or you send away or you get, others to do for you. What we expect a resident to do in a case like this. The first and the single most important thing.
Timeout.
So again, you need to see the central figure first. There is a small left esotropia. In this case, the eyes appear to be aligned. Extroversion on levo version, you can see the esotropia increases or the left eye is not abducting fully. So this is a case of a left sixth nerve palsy, acute onset for 2 weeks. The single most important clinical test, remember, is to look for fundus, because sixth nerve palsy can be a false localizing sign of a raised intracranial pressure. So clinically, the first most important test to be done is to check the fundus. Of course, I would say check the fundus for every patient who walks into your OPD, but this is here the most essential and very, very critical test to be done in a patient presenting with acute sixth nerve palsy. So I think I clear up here. We just have a small word from our sponsor, to whom we are very, very grateful to give us this opportunity to reach out to you and interact with you. So I just... So great, Lubrex. Thank you, Lubrex. And I will move on, and now I will stop share, and Dr. Vaishali will now continue the rest of this round for you. So Dr. Vaishali, please.
Thank you, Dr. Rohit.
We have to come to one-liners, ma'am.
Yes. Okay, so the one-liners. So this was a question, and the number of long posterior ciliary artery is last 2 seconds. Time's up. And again, very easy. Shall I give the answer?
Yes.
Sai?
Yes, please go.
Yes. So all of you have got it correctly. Coming to the next question. The OCT wavelength used in the posterior segment evaluation is in nanometers, Your time starts now. What is the wavelength done for the posterior segment OCT? That's 10 seconds. I hope you have submitted again. Time's up. Do I give the answer?
Yes.
It is 830 nanometers. Moving on to the third thing, the concentration of 45 cefazolin eye drops in milligram per ml is, the time starts now. All the residents are well aware of this. We get so many keratitis patients, and I'm sure all of you have done this. Last 10 seconds. Time's up. Again, I'm sure all of you have got it correctly. It is 50 milligram per ml. Moving on. Again, a simple thing. I think I must be the one who have got all the easiest things. So the lack of development of tissues during embryonic life is called a one-liner, rather a one word. Your time starts now. As simple as it gets. Just one word. You will need only 5 seconds to do that. Ten seconds. And the time's up. And the answer is unanimously aplasia. Coming to the last of this, again, simple thing. After Rohit sir's excellent 9-gaze pictures, I would just like to ask this. The paralysis of intrinsic eye muscles is called as dash of thermoplasia. The time starts. Last 10 seconds. Time's up. And the answer is internal ophthalmoplegia. So after the Brown syndrome and the lateral rectus sixth nerve palsy, we have this internal ophthalmoplegia.
I think it's time for you to share the screen.
Yeah. Shall I stop my share?
Yes, sir. Very. Now I request Dr. Uma Madam to continue with the second set.
Yeah, just there. So this is round 2 of the MCQs, and we are starting the next 15 set of questions for you. And okay, so this is MCQ round 2, and the first question for you all is again from physiology and very, very basic question. And the question is, what is stage 1 of dysfunctional lens syndrome? You have to give the correct answer, and your time starts now. Sorry. A is loss of contrast sensitivity. B, is it presbyopia? C, is it cataract? Or D, is it second sight? Your time starts now. Yes. So we know that dysfunctional lens syndrome is a description of the changes in the lens occurring with age. And one of the earliest, shall I disclose the answer, Sai?
Yes, ma'am.
Yes. And the first sign is presbyopia, that is stage 1. Stage 2 is all glare, and stage 3 is cataract. So the answer is B, presbyopia. So let's go to the next one. Something once again, a pharmacology question. What is the mechanism of action of repabamide in the management of dry eye? Is it A, mucolytic, B, mucin secretagogue, C, anti-inflammatory, or D, acts on matrix metalloproteinases? And your time starts now. Time is up. And shall we go for the answer?
Yes, yes.
And this drug is also used in gastric ulcers. So we know it's a mucin secretagogue, which increases the amount of mucin and protects the ocular surface also in dry eyes. So the next question is again neuroophthalmology. A lot of questions today on neuroophthalmology, and this is one for you. Lesion in which cerebral lobe causes a pie in the sky field effect? Relatively simple. A, occipital lobe, B, parietal lobe, C, temporal lobe, or D, frontal lobe. And your time starts now. Time's up. So we know the visual pathway well. We know the answer. Shall I go for the answer?
Yes.
Yes. So the pie in the sky is nothing but a homonymous superior quadrantanopia, which is seen in a temporal lobe lesion, also called as the Mayer's loop of the optic radiation which pass through the temporal lobe, and when there is a lesion there, it causes a pie in the sky field effect. So we go to the next question, and this question is on spastic entropion. Which of the following is a procedure for spastic entropion? Is it Brian Smith modification of Kunz-Zamenhof, or is it big procedure, or is it a quicker Rathbun suture, or is it Jones re and Wobick tucking of the inferior retractors? Your time starts now. So all names, but we know this procedure very well. Shall I go for the answer?
Yes.
It's a quick suture, and that's called a quicker Rathbun suture, which is done for spastic entropion. And suddenly one patient after cataract surgery patching, you find that he has developed spastic entropion, and this is one suture that you put there. It's caused because of the overriding of the preseptal muscles of the orbicularis. And the last question from me is 3.5. Where do the postganglionic parasympathetic fibers to the lacrimal gland begin? Parasympathetic fibers to the lacrimal gland. A, semilunar ganglion, B, spinopalatine ganglion, C, geniculate ganglion, or D, ciliary ganglion. Your time starts now. Up. So we should know why we cry, how we cry, right? So the answer, shall I give the answer?
Yes.
So the answer is nothing but sphenopalatine ganglion, otherwise called as the Meckel's ganglion or pterygopalatine ganglion. That is where the impulses come for the lacrimal gland as a parasympathetic fibers. So I here stop sharing the screen and hand over to Dr. Rohit. Over to you.
Thank you, Dr. Ma. I'll just start my share. So I hope my screen is visible and I go on to the full screen.
Yes, yes, please.
Okay, great. So I go on. I think this has been a heavy round on pediatric ophthalmology and neuro-ophthalmology. So continuing in the same vein, what is the incidence of amblyopia in the general population? I know you don't really think amblyopia has any really importance, but 1 to 2%, 2 to 3%, 3 to 4%, 5%. Now, the incidence, or actually the prevalence, I'll probably the inappropriate word, prevalence of amblyopia in the general population. So I hope I can go on to the answer.
Yes.
Answer is 2 to 3%. It's a fairly significant amount of prevalence, and of course should be considered important. So screen all children that come to you for a difference in vision in one or both eyes. So we go on to the next question. Which is the second most common nerve palsy post raised intracranial pressure? We just discussed the first most common nerve palsy in raised intracranial pressure. Which is the second most common nerve palsy? So the sixth nerve palsy, the fourth nerve palsy, the third nerve palsy, or the seventh palsy. If we start your time, the second most common. We always like to know the most common, but this was about the second most common. We go on to the answers. So the second most common is the fourth nerve palsy. So that's the second most common post raised ICT. It has a long course, and the fourth nerve has a very long course. And because of that, it also is moderately susceptible to the down push of the midbrain subsequent to a raised intracranial pressure. So this was the second most. We go on to the next question. Which of the following statements is true? So now you need to follow these. They are a rather difficult or complicated set about some things we don't think about so much. Fusional convergence is always accompanied with stimulation of accommodation. Divergence is a passive process. Divergence is always accompanied with relaxation of accommodation. And convergence is only a passive process. So which is true? The time starts now. So think about these motility issues, the binocular motility system, fusional convergence and divergence. So a little tough, I would surely say. At resident level, we don't think so much about fusional divergences. In fact, I don't think so much strabismus, speedophthal, and neurophthal is discussed. That has been discussed in this. So the answer is fusional convergence is always accompanied by stimulation of accommodation, because it is believed or the brain understands or realizes or feels that the object is near. So the near triad kicks in, which which includes accommodation, meiosis, and convergence of the eyes. So which of the following true? It was fusional convergence. We go on to the ninth question. Which of the following is not derived from neural crest cells? Again, this is a simple question. Ciliary muscles, corneal endothelium, the lens, or the trabecular mechanism. Now, not derived from neural crest cells. So this was, I think, quite a sitter. And the answer we know is lens. It's not derived from the neural crest cells, while the others would be. We go on to the last question, is on ametropic amblyopia. So is best treated with appropriate refractive correction, topical miotic drops, intermittent occlusion, or refractive correction with penalization. That's now the management of ametropic amblyopia. I think that again was not rather difficult. Ametropic amblyopia, we go on to the answer, is bilateral subnormal vision because of a moderate or high refractive error. The most important and the really only intervention is appropriate refractive correction, provided you're sure it is ametropic amblyopia. No other intervention, including occlusion, penalization, and any kind of pharmacological intervention is required. So thank you. I'll stop my share and I will hand over to Dr. Vaishali for the remaining of the MCQ questions.
Thank you, sir. And for the next round, yes. So we begin with the third set of MCQs. The direction of movement in nystagmus can be horizontal, vertical, rotatory, or it includes all of this. The time starts now. Yes, and I'm sure all of you have got it right. The answer is all three. Coming to the next question. The preferred surgery for severe ptosis with poor LPS action is fascicular cervic, levator resection, brow suspension, or all of the above. Your time starts now. Time's up. And ptosis, again, it is very commonly seen in all OPDs, and all the residents have to know the ptosis by heart, the measurements, the MRD levels, and its management. So the answer to this question is yes, a brow suspension or the sling surgery. Coming to the next question. What are the daily requirements of vitamin A in an adult? The options are 300 to 750 microgram, 750 to 1000 microgram, 1100 to 4600, or is it more than 5000 micrograms? And the time starts now. Time's up, and we were talking about the adults. So the answer is 300 to 750 micrograms. Vitamin A, we are all aware the importance of vitamin A, especially for the xerosis and the classification of vitamin A. We need to know everything. Coming to the next question, FIM test is helpful in diagnosing A, sarcoidosis, B, histoplasmosis, C, tuberculosis, and D, coccidomycosis. Time starts now. The time's up, and the answer is A, sarcoidosis. Again, here a gallium scan is also important. So we have to do the QIM test and the gallium uptake test also. Moving on to the next question. Large angle of deviation and cross fixation are the highlights of infantile exotropia, B. Infantile esotropia, C. Six-nerve palsy, retractions. The time starts now. Very simple. Time's up. And the answer is infantile esotropia. So we characteristically tell about the large angle of deviation, cross fixation, and earlier parents come at a very early age, and moreover, it is mostly associated with the inferior oblique overaction. So I stop my share and I request Dr. Uma ma'am for her one-liners.
No, I think we have to, at the conclusion of the slide, take you out as well. So I request Dr. Rohit, Dr. Uma, Dr. Vaishali to join us on the screen. Sai, are we ready with the leaderboard? Can we have the top 10 teams with us?
Yes,
Yeah. So meanwhile, we have Professor Dr. Somen Mishra and also see Dr. Siddiqui as a mentor. Dr. Somen Mishra is from AIMS Raipur. Sir, can you hear us? You can get your video on. We would love to have you with us.
Yes, yes.
We also have Siddiqui
Good
sir.
evening, Professor. I can hear you.
Good evening, Siddiqui sir. Welcome. Thank you for being with us and being persistently behind your team. We are so proud to see the
Good evening, Dr.
strength with
Prashant.
which you are standing here.
Good evening, Dr. Siddiqui. How are you?
Fine, sir. Very fine, sir. Thank you, sir, for remembering me.
So nice to see you, sir. When I saw you are on.
Thank you, sir. Thank you.
Sir.
We also have
Good
Dr.
evening,
Mishra, sir.
Good evening.
Hello, Dr. Somen Mishra.
So sir is from Maharashtra, but now he's heading the AIMS Raipur. So we
Yes.
are proud of him. We also have Maharashtra Ophthalmological Society President Dr. Santosh Bhide. Sir, can you join us with your video on? Welcome, Dr. Santosh Bhide. You're muted.
Welcome, Dr. Bide. Very nice.
How are you? Excellent program. Kudos to you, Prashant, and Dr. Shilpi also, and all the professors, Rohit, Dr. Vaishali, and Dr. Uma Madam. And actually, Maharashtra Ophthalmological Society is also planning to have an online PG teaching program, which will be there next Thursday,
So
between 8 to 9. And it will be alternate Thursdays, that is twice a month in the Thursdays. The topic next time will be cornea, and next month it will be cataract. After that, it will be glaucoma, and so on. So every month we will be doing twice a month Thursday, because Wednesday is Dr. Prashant's day, and he is going to have a great quiz
Yeah.
throughout the year.
Prashant is blocked all Wednesdays now.
Yeah, so that's why we have.
They're not available. They're not available this year.
Yeah, so we did in fact 3 online PG programs on last 3 Wednesdays. So I request all the PG students to join online PG teaching by Maharashtra Ophthalmological Society, and looking forward to your inputs also, all the professors and teachers and mentors, and all the best to Prashant and everybody, and Happy New Year to all.
Excellent. I think everybody having a topic wise PG teaching is very, very good. You can have, cover a lot. The topic can be very nicely discussed. So
What we have done is that
also
there
get
will be
prepared.
2 case presentations by PGs, followed by 2 talks by experts in that field, and a small quiz. We took inspiration from Prashant, and we have kept a
Yes.
small quiz of only 5 questions. So at the end of
Fabulous.
the year, we will sum all the results, and then we are going to plan to give some.
Excellent. MOS is anyway doing a great job.
yeah,
So-
Dr. Santosh Bhide's leadership, he has they were having quite a proactive president of our Maharashtra Ophthalmological Society, carrying out multiple activities, and one of this is his brainchild about having PG activities. Also, ours was the first state to initiate the action against us and all those things. And he has
He had two
another meeting to
webinars.
chair at 9:30. We are so thankful to him for being with us and sparing his time and encouraging us. Of course, as a president of Maharashtra Ophthalmological Society, besides being my dear friend, thank you, Santosh, for being with
Thank
us.
you, Prashant.
We are
Thanks.
extremely thankful to you for being with us.
Opportunity
Okay.
to tell
And
all the
yes,
PGs to join this
yeah.
thing.
Yes,
I have to attend
postgraduate.
another meeting, so with your permission, I'll take a leave.
Thank you. Thank you. So all the
Thank you, Ravi.
postgraduates who
All PGs
log
are
into
so
the
lucky to
Thursday.
have all these functions.
Thank you. Thank you. I think, do we have the leaderboard meanwhile? Sai?
Requesting everybody
Yes,
to
Dr.
join next
It's
Thursday
taking some
also.
time.
Bye.
Yeah. Bye-bye. Thank you. Yes, Sai, you said something. We missed upon you.
No, it's taking a little time to download, Doctor.
You will need some more time. So Uma
Really?
madam has been an old fox with us in our brain teaser gang, Rohit and Vaishali, and she's an ace quiz master. You should have attended some of the KOS quizzes. And that's why this time practically I dragged her in spite of her busy schedule. She commitments, but we wanted her to be part of our initial quiz. So we gather more
Excellent.
and more people with us.
And as Dr. Lalit was saying, your format is very, very good.
Yeah.
No, I think it's a good. Today also we have almost 405 teams logged on with this Kahoot and 30 odd teams from on a YouTube platform. So today I think we will have to see why we are missing upon 100 plus teams. We will have to look into it. But yes, they have for postgraduates who are attending right now, remember, even if you miss one or two quizzes, or even if your colleagues have missed today's quiz or previous quiz, they should not get disheartened. You have 6 more quizzes to participate, preliminary rounds, and the best of the 4 performances will be considered for getting into the quarterfinals. So if few of your friends, few of your colleagues have missed upon this preliminary round, ask them to log in at the next time, because it's going to be a big prize money. Besides that, the learning, and you will also have the time to share and learn from these big professors and big quizzes of our country. Importantly, the best 10 teams performing on that day will be invited live on the Zoom platform, where you will be seen nationally, internationally. You will be on the YouTube as one of the achievers of that particular episode. And remember, people will have a long memory if you are on the screen and you are patted by big people like Dr. Rohit Saxena, Dr. Uma Kulkarni, and Vaishali Une. So it's the time for you to participate, come in a big way, and share the screen with such great stalwarts in ophthalmology, which you will rarely get an opportunity in future as well. So do share it with your friends, and we expect you to share and join in a big number. Also, we are thankful to you for joining this time. Remember, by the time our leaderboard is ready, this time and the last time was our first time, so we got a bit delayed. Next time, as I said, discipline is what we always imbibed with us in Brain Teasers. This is the biggest platform and overwhelming participation. So we had some hiccups. But from next time, you are expected to log in by 7:30 latest, and 8 o'clock sharp, we will be initiating the quiz, whether the teams join us or not. So here is the leaderboard for today. So we have team number 1 is Nick, then DH, then you can see the screen. So the first 10 teams are Nick, DH, okay, Jishnu, then PG, this particular thing, then PG. And so first 10 teams, we request you to join us on the Zoom platform. We would like to have a chat with you. We would like to see who are these young.
I request them to post on the comments box so that we'll know who they are and we can bring them on board.
Intelligent brains who have, okay. So please, number 10, up to number 10 teams, please post on the comment box who are your details, so that we can send you the Zoom link and you can join us. I think they are already on the Zoom platform, na, Sai? So these teams can definitely join us.
I'm promoting them one by one, Doctor.
And yes, number 11 to, yeah. So number of marks, it's hardly minimal. Sure, the underdogs can perform. If you see the signature video of our Big Q, I showed intentionally the World Cup finals, means Kapil Dev holding the cup. You know, in 1983, India was underdog. It never be able to make finals. Rather, we never thought we would be able to make to quarterfinals, semi-finals, and ever a final. But the underdog performed. So it's time for you to remember, do not get disheartened by today's score. You have 6 more rounds to perform and can achieve. And the biggest example has been Kapil Dev and his team, that is our Indian cricket team. Don't get disheartened. We expect you to perform well. Do join us on the next event, which is be on the coming Saturday, coming Wednesday on 18th at 8 p.m. sharp. So do not forget to log in. Meanwhile, we request the number 10 platform so we can have some chat with this greats in ophthalmology. Please do join us immediately. So let me see the. Okay. Anyone has joined? Meanwhile, yes, we have team. Yeah. So
Top
we
10,
have
the difference is only of 4 marks, I guess.
Exactly. So we have Nick team Nick. Okay. We have Jishnu. I think Jishnu was within first 10. Jishnu, can you get your video on? We would like to see you. The whole world wants to know who is the Jishnu who has come second time in first 10. Okay. So, Sai, how many teams have logged in?
1, 2, 3.
I mean, logging in, Dr. Dev.
Yeah. So meanwhile, we can chat. Yes, Rohit, what do you think about this Jishnu team? Jishnu team, can you introduce yourself and get your video on?
Sir, is that video on, sir?
Yeah.
Yeah, video is on. We can see you, although we can only see part of your faces. You need the camera a little way. Yeah, now we can see you both. Where are you from?
Introduce. Come on, introduce yourself.
Sir, I am Dr. Parth Palan, and I'm a first year resident from LV Prasad Eye Institute, Hyderabad.
And I'm
habitual of say winner is Mr. Herur.
yeah.
Correct? Jishnu H. Did I interrupt you? Hello.
No, not at all.
Hello.
Hello, am I audible?
Yeah. Go ahead.
Yeah, I'm Anirudh Herur, and I'm also I'm his batchmate. I'm a first year resident at LV Prasad, Hyderabad.
Superb. So, what's this Jishnu H stand for?
So last time also we were asked the same question, but Dr. Prashad. So basically, we got to know of this quiz pretty late. So what we did was last time while registering, we couldn't find a proper name. So we put the name of our apartment, the apartment where we live, and it's named Jishnu. So that's what we named our quiz team. And
okay, wonderful. Great.
Yeah, but then we searched in Telugu, so it means Vishnu.
Arey, kya baat. So Vishnu ka Ashirwad tumhare saath hai. I mean, come on, there is nothing. Vishnu is with you, then will circumvent all obstacles on your path. Victory. That's great.
Lucky charm, Jishnu seems to be a lucky charm for you both.
Definitely, ma'am.
Yeah. Oculus Repario also. I'm sure we will want to know what Oculus Repario has been listed as your name, but please introduce yourself first.
Hello, I am Neet Mehta. I am a third year resident at LV Prasad, Hyderabad. And with me, I'm
Dr. Prapti, and I'm a first year secondary DNB resident at LV Prasad, Hyderabad. So Oculus Reparo is basically from Harry Potter, which it's like a spell where they repair the spectacles. So basically anything you repair related to eye, it's Oculus Reparo.
Great.
Great, wonderful.
Great. So I think there is a big competition between first year resident and final year resident.
We have others also now available. We can ask Oro Masters are there. Just keeping your screens on so that Oro Masters are two young ladies. Please introduce yourself.
I'm Dr. Shafina. I'm Dr. Geetu. We are from Aravind Eye Hospital, Coimbatore.
That's why the Oro. I was just wondering.
Yeah.
So Dr. Chandrasekhar has prepared you?
No, sir.
He's not your mentor.
He's not our mentor.
It's not our mentor.
Who is your mentor this time?
Dr. Pranesh. He's from he's a retina fellow.
Okay.
So he's our mentor.
Okay, next.
We have Nick and DH.
So,
Have
do
they joined?
congratulate him on behalf of our team.
Thank you, sir.
Krishnan.
The topper, Nick, do we have them?
Nick is not there at the moment.
She's Nikita Gupta. We are trying to pull her in. She's unable to, but she's still trying.
Nikita Gupta, Panchami Gupta is related. Yes.
Hi.
Hello.
She's my younger sister.
We know, I know. So why is she not joining us?
Sir, I've called her and told her, but I think there's some, I don't know.
Where is she now?
Last time also you were there, right?
So she, yes, ma'am.
The sisters were there last time also.
Ma'am, actually last time the winners were not allowed, so we didn't see the last time score.
So where is Nikita now?
Sir, right now she's at home.
No, she's completed her.
So she's joined Center for Sight. New
Okay,
Delhi.
she completed her MCH, right?
Yeah. So she's completed her MCH back in Delhi and she's joined Center for Sight now.
Great, wonderful. So we are proud of her. Hope to see her. She is
sir.
the alumni.
Hopefully she'll be able to join.
Yes. So that's very nice. Yes, and we have Kailash and Krishnan here. KK,
all of them.
My name is Dr. Kailash Krishnan. I'm from the final year PG from RRMCH in Bangalore.
And I am Dr. Suyog, final year PG from RRMCH Bangalore.
Wow, great. Great. Well played. RR is what? What does it stand for?
Rajarajeshwari Medical College and Hospital.
Very good. And who is your mentor?
Dr. Nanda L.
Do congratulate her.
Thank you, sir.
Do convey her our congratulations, and we expect her to be with us next time so that we can also, she would be proud to see you performing so well, rather I should say. Besides, it will be privilege for us to host. Okay?
Yes, sir.
Congratulations. Well played.
Thank you, sir.
Well played.
Thank you, sir.
Congratulations to all the winners.
How was the experience? Did you find it too tough, too easy?
Just have something else to do. Thank you all.
Who is leaving? Hello.
Hello.
Okay. Who is this Peaky Blinders? Pinky Blinders. Peaky Blinders.
Peaky Blinders.
Sir, is sir audible?
Yeah, please get louder.
Yes, sir. Good evening, sir. We are from NSCB Medical College, Jabalpur. I am a third year resident. Dr. Palak Patwa.
Sir, I am Dr. Shivam Pandey, second year resident.
Very well.
Dr. Siddiqui is your mentor.
Yes, sir.
Yes. Congratulations,
Very happy
Siddiqui.
to
Your
see a
team's
team
performed.
from Jabalpur. Very happy to see you. It was one of my regions where I used to be operating for a pretty long period of time for 15 years of my career, and so happy to see from one of the just from our region. Okay.
Thank you.
Okay.
Congratulations, Dr. Siddiqui.
And do
Thank you, sir. Thank you.
Thank you. Congratulations. I think we are through with all the teams. Sai, could we get the prizes of the general private practitioners who participated?
When Dr. Disha has joined, you can.
Doctor?
Disha.
Sai, what about
The naming is not done properly, madam, so it will take some time to track it down.
Good evening, sir.
Welcome, Dr. Disha. What's
Yeah,
your
sir, DH, second in position.
Congratulations. Very good.
Congratulations.
So myself, Dr. Disha Agarwal. I am a final year PG in JIPMER, Pondicherry.
Okay.
And my partner.
Myself, Dr. Heyman, sir. I'm also a final year from Jipmer.
You were amongst the top 10 teams last time also, correct?
No, sir.
Okay. Last time we had.
That were our colleagues, sir.
Okay. So it is a jigsaw, seesaw. Right now you are leading. That's great. Can we have your photos there? We would like to. Everyone would like to see who are this, big brains. Come on.
And Chinta and Shravya, if you can make it landscape, we can't see both of you together.
Yeah, if you make it landscape, we can see both of you.
Actually, we have joined from laptops, sir.
Oh, no, I was actually talking about Chinta and Shravya.
Yeah. Okay, good. So
yes,
proud of
Disha,
you.
great. We can see both of you.
Good evening, sir.
Yes.
So we are from Kurnool Medical College, Regional Eye Hospital. This is Dr. Vinita and she is Dr. Shravya.
Good evening, sir.
We are at 5th position, sir.
Very good. Congratulations.
Congratulations.
Thank you.
Thank you.
Dr. Prashant, was it by intention that this was predominantly pediatric ophthalmology, strabismus, and ophthalmology?
That's
you
what
put us all together just so that you could scare the kids ki kuch aur bhi pad liya karo cornea retina ke alawa.
That's what I was wondering. It was quite a bias, but when I was doing my post graduation, pediatric ophthalmology, squint, and neurology, I never understood. Had I been in their position, I would have been on the 500 number. But these guys are big brains. They even in first year they did so much. I'm really amazed by their knowledge, at least in difficult subjects like neuro-ophthalmology and pediatric ophthalmology. So
Ramesha को congratulate करना पड़ेगा. बाकी तो सब कुछ ठीक है. Ramesha को बोलना पड़ेगा कि he's done a great job.
Yeah. But across country, you see the awareness. These guys who are number 10, first 10, they performed extremely well. Or look at the scoreboard, you will see almost up to 50. They are all just
Neck to neck.
So
all clustered into
neck to neck.
Close to each other. Yeah.
So it means their understanding of the subject is quite well. And by choice or by default, I don't know. Today, all you pediatric ophthalmologists came together.
Yeah, and Nikita ने तो वहाँ कोई pedophthalmology करी नहीं होगी. I'll have to take credit for Nikita doing so well in pediatric ophthalmology and neuro-ophthalmology part of the quiz. Nikita is our postgraduate. She's done her MCH in retina, no?
Yes, sir. Vitreoretina from PGI Chandigarh.
Yeah, Vitreoretina MCH from PGI Chandigarh. So वही मैंने कहा ये जो answers ने किया ना हमारे ज्ञान के कारण नहीं किया.
So she wants to thank you. Actually, she's not able to join. I called her. She said the link is not working or something.
So,
Dr. Rohit, I would like to bring to your notice that number 15 is called as recession 2. I don't know where they are from, but then I'm sure they are the strabismologist or the future strabismologist.
Yeah. Or they're financial wizards and they know the world is going through a recession.
I think it's time we had a good interaction with all these 10 top performing.
Good evening, sir.
Hello, Nikita. Great to see you.
Nikita, welcome.
Hello, sir.
Once more, congratulations, Nikita.
Thank you so much,
so
sir.
Proud of you.
Yes.
Keep on stealing off, pulling off the good show every time. We are so proud of you.
Thank you so much, sir. It was a great quiz.
So I think it's time for us now. It's already quite late. Thank you. So I think now it's time for us to say goodbye from our end. Thank you, Dr. Rohit, Dr. Vaishali, and Dr. Uma for being with us and conducting the quiz so gracefully, so eloquently, and so it was so learning even for people like me. Okay. So thank you, everyone. Thank you, the mentors, Dr. Professor Siddiqui Saab, Dr. Somen Mishra Saab, for joining us and being with us here. It was definitely a moment. Yes, students, you should note a professor at this level are keen to participate and see their students excelling. How are they performing? Speaks about their commitment to you. We are so proud to have in our country teachers like Dr. Siddiqui and Somen Mishra sir. We are proud to have teachers like you, sir. Once more, we will thank you for your participation.
Thank you, Dr.
It's time for us to say goodbye. And so, friends, next Wednesday, again, we are going to have the third round of our preliminary rounds at the same time, 8 p.m. But next time, do maintain the discipline. We will be starting sharp at 8 p.m. You will have to log in by 7:30 latest. Also, do share this word with your other colleagues, co-residents, so that they also log in and they still have the benefit of next 6 preliminary rounds where they can catch up with you people for the quarterfinals. With this,
thank you. Bye-bye.
Bye-bye.
Thank you so
goodbye.
much.
And once more, thanks to Microvision and bye-bye. Bye-bye. Bye.
Bye.
Thank you,
Thank you.
everyone.
It was a wonderful experience. Thank you.
Thank you, madam. Thank you.